just go ahead and ask it again. Can you mistake your period with pregnancy, or is it something I have to consult with a doctor? So you think you might be pregnant? Like if your period is normal, most often you're not pregnant. But if it was unusual for some reason, then there we go. Hello, Facebook, Instagram. We are live there. We were just talking about how to tell if it's a period or if you're pregnant. Usually if your period's like the same as normal, I would just go on with your life. If it seems different or odd, then you might want to talk with your provider. Can you have a miscarriage at 16 to 18, 19 weeks? You can. You can miscarry or have a stillbirth at any point in time. The rates are much lower after your first trimester. So once you hit about 12 weeks, and then they raise up again as you get closer to your due date, and especially past your due date, which is why doctors usually recommend being induced by about 41 weeks. How many weeks does your baby start kicking? Baby is kicking right now. You just can't always feel it. So they are moving in there. It just takes a while depending on where your placenta is. If anybody else has this question, tell us in the comments. Because it's very normal to be like, when am I going to feel the baby move? And it just sometimes takes a while for some people. If you have an anterior placenta, which is where the placenta is in the front, like behind your belly button, then you're much less likely to feel the baby's kicks, unfortunately. So usually people feel them between 16 to 20 weeks. When do you normally feel babies? Big kicks to like where dad can feel them usually would be like heading into your third trimester, so 27 weeks. Does the baby know the gender before we do? I mean, define does the baby know? I don't know that we know what the baby knows during pregnancy. Is it normal to feel pregnancy symptoms some days more than others at 7 weeks? Yes, because as baby's growing, those hormones in the beginning are really like all over the place. So yeah, your body is just experiencing all the things right now. If you guys have questions, Instagram, Facebook, YouTube, feel free to ask them in the comments. How can you get pregnant if you've been trying for a year now? What can you do? If you've been trying, so average time to get pregnant is 9 months. If you've been trying that long, I would probably recommend going to see your provider. I think that'll be most helpful. They can do some basic lab work, just discuss like what you've been doing to try, make sure that it works, really check out specific things to you. 4 months pregnant, but I haven't gained weight. Any tips? The baby is fine. Sometimes in those early months, because you're feeling nauseous and you're just not eating much more, it's not unusual to not have gained too much weight. So talk with your provider if you have concerns so that they can address them. So many people in here, so many questions. Thanks, guys. Hi, I'm Hillary. I'm the pregnancy nurse. I'm your bump to bassinet bestie, where we get you prepared for your upcoming birth, most likely a hospital birth. That is the only type of birth that I have experience with. I'm also the creator of the online prenatal class for couples, which is the easy way to get prepared for birth. It is a virtual class taught by an expert, available whenever the heck you want. Sunday nights at 10 p.m. I am waiting there for you. So I just want people to get prepared for birth. I think it's wildly important. So thanks for being here. I'm going to head back into questions. I'm 4 months pregnant, but haven't gained weight. Any tips? I'm 16 weeks now. Yeah. So usually you don't really start to gain weight till maybe even well into your second trimester. So it doesn't seem unusual. If you have any questions, ask your provider. Weighing is an important part of your prenatal exam, because if you were to gain a lot of weight or not be gaining weight, it is something we want to look at. I'm 25 weeks pregnant now. I suffer from abdomen pain. Sharp abdomen pain is something you should bring up with your provider. If it's enough that it's affecting your day-to-day living, you should call and get an appointment. If it's just now and then, you can probably wait till your next appointment to talk with them. Can you tell us more about SUA? I'm not sure what SUA is. Are there any risks for early genetic testing, the one for seeing who the baby's father is? I do not know much about that type of genetic testing. Is that amniocentesis? So the risk would be that they could rupture the sac. Oh, single umbilical artery. Sorry. So the risk for single umbilical artery is you want to make sure the baby has both kidneys, because a lot of times when they only have one artery, there can be kidney problems. And so, and then there will be follow-ups for baby after to just make sure that things are well. I've had friends who had a single umbilical artery and everything turned out fine. So I've been congested for whole months, mainly after eating. So you have all this extra blood flow in your body, and it really goes to your mucous membranes, which your nose is part of. And so those can swell, which makes you feel congested, which it's just miserable. So ask your provider. The question is, is it congestion or is it the swelling of those membranes? Talk with your provider, see if there's anything they can recommend. Some people have luck with like a saline rinse. I am not scrolling back to answer questions. I'm sorry. So just if you had a question you want it answered, feel free to ask it again. Things are just moving too fast. I'm 30 with 6 weeks pregnant with preeclampsia. What are my risks to be induced? So if your blood pressure is high enough or you have other symptoms, because with preeclampsia, it's not just blood pressure. If your lactic or uric acid's going up, your platelets are going down, your protein creatinine ratio is going up, then they will encourage you to be induced, or they will offer an induction. And then of course it's always up to you, but preeclampsia is not something to mess around with. The main thing that we believe that fixes preeclampsia is getting the placenta out of your body, because that tells your body to chill the heck out. However, you can still have preeclampsia well into like 6 weeks postpartum. So I took a pregnancy test yesterday. Was a faint positive, took another 2 hours later and it was negative. So the first thing in the morning is the time where you have the most HCG in your system. So later in the day you have a little bit less. It's just not as concentrated as it is early in the morning. So I would wait a couple days and take one again. However, the likelihood of a false positive pregnancy test is pretty low. Likely you're positive, but if it was me, I would wait a couple days and take a test again and just try and stay busy in the meantime. I know it is hard. Yeah, so I would test again in a couple days. Yes, so I'm thinking Michelle is talking about preeclampsia. I've seen a lot of very healthy babies with preeclampsia. You just need to be on top of it and make sure that your body is doing okay. Brandy said, just had light brown spotting this morning. I'm 5 weeks. Should I be concerned? So spotting comes in different types. There's bright red, which means that the bleeding was more recently, or brown would be older blood. Spotting early in pregnancy isn't usually my favorite. However, some spotting can happen with implantation as your uterus is growing and things like that. So keep an eye on it. If it's more or bright red, you need to call your provider. Should my blood pressure have been checked at my first appointment? Probably. I would think that they would want a baseline to see if you started out with high blood pressure. I'm not a fan that it wasn't taken, but sometimes those first appointments, they almost ignore you entirely, and it's all about insurance and maybe drawing labs. I don't know. So how do I get a pediatrician for my baby? All of that is an awesome question. I can't tell you how many patients I would ask them who the baby's doctor was going to be, and they would just kind of like blink at me like, my OB's not going to see the doctor. So great question. Check your insurance. That's obviously number one. Look for somebody close, because you're going to be going to pediatrician appointments frequently in the first year. So somebody close by is very valuable. Check for what hours they're open, because it seems like everything seems to happen after office hours is closed. So do they have a night clinic that you can go to, or are there night triage nurses, which is what I worked as when I worked for a pediatrician. I worked in their night emergency clinic, and we answered phone triage all night long. So those are the things. And then obviously you want one that matches you. Personally, I wanted a very low-key pediatrician. I didn't want one that was going to freak out at the smallest things. So that's the kind of pediatrician I wanted. You have to kind of decide what will match your parenting style. Pediatricians are very easy to change. A lot of them are in large practices. So if you find one and you go to one that you don't like, sometimes like when I worked for the pediatrician at the desk, they would say, I'm looking for one that's a little more conservative or liberal with their treatments, or is more on time. And sometimes I'd slip you some information. So that's something you could do. Ask around, see who your friends like. But it's very easy to change a pediatrician, and it is worth your time, because you want one that matches you, sort of. Thank you for the follow and thank you for the hearts, everybody. That's so nice. In case we haven't met, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience. I am your bump to bassinet bestie, and I'm the creator of the online prenatal class for couples, a virtual birth class that gets you prepared for birth in under 3 hours, and it's available whenever you want. So if you have questions about my birth class, please ask me in the comments. You can save 10% today with coupon code FASTERBIRTH, all one word. Any advice for your baby not latching on? I've tried everything. Ugh, breastfeeding is so tough, which is why it's not going to help you. But in the online prenatal class for couples, if you get the bump to bassinet bundle, it includes a breastfeeding class, because I just think there is not enough breastfeeding preparation out there. However, you can really only do so much. I had the breastfeeding mama come in the class. She's the one who teaches the breastfeeding class, and I send all my people to her. The breastfeeding mama is what she is on all social platforms, and I think she's great. Been trying to 10 months after Nexplanon have regular periods and ovulation. So after 9 months or so, I would call your doctor, see if there's anything they can do. Routine lab work, check your thyroid, check basic hormone levels, talk to you about like what you're doing and seeing if they could recommend anything along those lines. I will say that we thought we were trying enough, and my doctor was like, no, that's not enough. So then we upped how much we were trying, and it did help. So sometimes things like that can help too. I have 5 weeks and they couldn't hear his heartbeat. I'm a bit worried. Is this normal? If they couldn't hear it in the office with the Doppler, not unusual at 5 weeks. That is a really tough one to get. If they can't see it on ultrasound, hopefully they just scheduled an ultrasound later on, and that should help out. Can you talk about intimacy during pregnancy? What's okay, not okay? It really depends on what's okay with your provider. Like if you're on preterm labor precautions, if they've told you to take it easy, things like that. So just be really explicit with them. If they haven't really said anything, then usually you're good. So, but make sure that you're comfortable with the things that are going on and all that, because emotions might be heightened, or it may feel different down there. I have a few posts on that as well. Yeah, so Lily was saying that she couldn't hear the baby's heart rate at 5 weeks, and then they heard it at 7 weeks and they had a healthy baby. Yes. On my first baby, we went in for an ultrasound and they were like, we don't see a heartbeat. And the doctor was a big fat jerk and was like, 50-50 chance your baby's dead. That's literally what he said to us. Long blink. But we went 2 weeks later and there was a heartbeat, and he's 24 now. So, and still doing things to make me long blink. What's your opinion on natural home births for a first-time mom? If you're doing a home birth, I recommend it on your second baby. They have shown that that's safer than on your first baby. I don't know much about home birth. I'm obviously much more comfortable with hospital birth, so you have to take it with a grain of salt. I love home birth stories. I think they are magical. I just can't listen to them until after the baby's born. Oh, they didn't let your partner go into the ultrasound. That totally sucks. Why? That drives me crazy. Because if you were potentially to get bad news in there, of course you want the support of a partner. Why would they not want the partner in there? It's super annoying. They also told me if they can't hear it, I will most likely miscarry at 5 weeks. I mean, like my doctor said, 50-50 chance the baby's dead, even though he was a horrible, horrible human being. So, you just have to, it's just a bit of a waiting game. I do not know much about DPO, so I'm going to stay away from those questions. Is it normal to have symptoms? I'm 8 weeks one day and have nothing but being tired. Yep, that's all I really had with my first few pregnancies. And it got worse with everyone. I was more tired. So I never threw up on my first two. I felt tired. I didn't like brushing my teeth. And I had a few other weird ones, but nothing, yeah. Trying to decline a co-host. I've been off birth control for 5 months and now my ovulation tests come back negative. Oh, that's tough. Talk with your provider. I got nothing there. I just found I'm pregnant 5 weeks exactly today. Congratulations. Why is my first appointment 7 weeks away? So you're going to be 12 weeks? I'm finding that to be the norm. OBGYNs must just be super, super busy. Options would be to call a different provider's office. I am a huge fan of certified nurse midwives, and often they can get you in the office earlier. If you guys are going to a midwife, tell us in the comments. A certified nurse midwife, that is different than a lay midwife or a professional midwife or a certified nurse, or I think they're called licensed midwives. It really depends on your state what they're called, but that's something you could look at too. But if you're not seeing your provider until 12 weeks, you need to ask them if you should be starting aspirin. They recommend that you start it by 12 weeks to decrease your chances of preeclampsia. So if anybody's on aspirin, tell us in the comments. Good luck, Mariella. Good luck with that. Would you have a positive test 3 weeks after? You should, because usually you would miss your period like 2 weeks later. And usually you can take that pregnancy test when you would have missed your period. So you should have a positive test then, but I am not the queen of pregnancy tests. Much more about delivering the babies. 37 weeks pregnant, having rib pain. I'm ready to induce this labor. What can I do? I have read so many studies on all of it. I have a post on the Pregnancy Nurse about what you can do. Really nothing shows anything. The only thing that shows a little bit of promise is castor oil, but it does have a lot of side effects. And if you are thinking about doing it, I would 100% talk with your provider ahead of time so they both know and they can counsel you what things to watch for. But as far as that, there really is nothing you can do to put yourself into labor. It's really unfortunate. I wish I would have eaten more frozen yogurt. I stressed about it way too much. Do you recommend prenatal yoga? I love stretching. I'm not a huge yoga fan. I don't love holding poses. That's just a personal preference. But I loved prenatal stretching. I think it makes you feel so much better. I do not know much about birth control, so I'm going to skip those. Trying for fourth baby C-section. You're not pregnant with it yet? Has your provider told you a time that you should be done? I've seen 4, some I've seen them say 3rd. A lot of times it's based on what your uterus looked like last time, but yeah. Is folate the same thing as folic acid? Because my prenatal vitamins say folate. Folate is the... Now I'm mixing them up. Talk with your provider. Folic acid is what they recommend to have in prenatal vitamins. Usually the more expensive ones have folate. If you see the OBs online, they are very clear that you should be taking folic acid because that is what has been proven to take to decrease neural tube defects. So talk with your provider. Ectopic pregnancy is able to be taken care of under a state that's anti-abortion for surgery. I do not know. That is way above my pay grade. Usually if you would have had your period, you're good to take the pregnancy test. So if you're past your period date, you should be able to take one. Shayla, I'm going to have to run and get some today. Let me double check that folate. I think folic acid is the like vitamin form. Folate refers to all forms of vitamin B9. Well, folic acid is one of those forms. There you go. Can they treat H. pylori in early pregnancy? Usually they treat that with antibiotics, I believe, and you'd need to ask. Some antibiotics can hurt baby's growing body, so up to you. Is working out while pregnant safe if you didn't have a workout routine before, say CrossFit? I always say to, you can start a little bit below what you were before you got pregnant, and then you can see if you can work up. But you don't want to start, especially if you've taken a few weeks off, you don't want to start where you were, and you don't want to overdo things. So talk with your provider and ease into things. So it's good if I just take the folate and the prenatal vitamins, or should I also get some? So most providers will say you need to take folic acid. That is what has been proven to prevent neural tube defects. However, a lot of people are saying that folate's better for you. However, the studies show folic acid. They haven't tested. There's no way to do a test on folate because we already know that folic acid is what prevented them. So they can never do a test on anything else, apparently. oh, because of H. pylori you have hyperemesis, well then ask them how they're going to fix it. Yeah. Something about Clearblue. Clearblue pregnancy test is a true Clearblue. No, they're all accurate. I honestly just use the dollar store ones because I was taking them frequently. I had infertility with my last baby, and I think they're just as good as the other ones. 31 weeks pregnant and having pain down there, like in your birth canal. It can be really confusing. I have a bunch of posts on the Pregnancy Nurse website, which is my link in profile, that talk about like pelvic pain and stuff like that. So you might want to just look at those and see what the different options are, because it's hard to know exactly because there's a lot of different things down there that could be thing. Does implantation mean bleeding always mean twin pregnancy? No. What do you recommend for somebody struggling with infertility after years of birth control? I mean, birth control is out of your system. It would just be infertility. I would recommend talking with your GP, your regular provider, see what they recommend, or your regular OBGYN, see if they can do some regular blood tests. Yeah, and I wish you the best of luck. That's difficult. Okay, last call for questions. In case we haven't met, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I am the creator of the online prenatal class for couples, The Easy Way to Get Prepared for Birth. It is the internet's favorite virtual birth class. I am there at Sunday nights at 10 p.m. I'm there Sunday mornings at 5 a.m. Whenever you want to meet me, I'm going to be there waiting for you so that you can get prepared for birth. It only takes 3 hours for the main class. So if anybody has questions about that, please ask them in the comments. Thank you for all the follows. That's so awesome. Is every stool softener safe for pregnancy? I do not believe so. Most providers I know are really just recommending increasing your fiber. There are some like fiber supplements you can take. My doctor had me like eating these graham crackers that were filled with fiber. Increasing fiber and fluids in your diet really is the best way long term, but you might be able to take something else, but you need to ask them. What was your schooling like? How many years did it take you to become a labor nurse? So I went to school. I got my bachelor's degree that came with an RN. And then you could go right out and be a labor nurse. But I worked nursing home for a couple years, hospice for a year. While I was doing those, I also worked for a pediatrician, like as a second job. I went to labor and delivery. Yeah. But once labor and delivery nurse, there is a lot of training on the floor as a labor nurse. A prenatal with fiber in it. Oh, that'd be magical. I don't know of that one. And a lot of times if they add iron, which a lot of people get because they're anemic, then you just got like boatloads of fiber, which really, or boatloads like constipation. You need that fiber to make things move. So yeah, that would be nice. All right. Looks like I've squeezed all the questions out. If you guys have any more, feel free to ask them. But otherwise, I hope to see you guys in the online prenatal class for couples. If you like this format, you're going to love that class because we're just going to go through everything beginning to end. What was my schedule like with 2 nursing jobs? The pediatrician was at night, so I could even work it after the nursing home. Yeah. So, but there's so many nurses that work more than one job. All right. When is my birth class? Was that the question? My birth class is available virtually online whenever you're available. So it's a virtual class that you sit down and watch just like this. It starts at $89, but you can get 10% off today only with coupon code FASTERBIRTH. Yeah, I would love to see you in there. It goes from everything from third trimester, like third trimester testing, what to go to the doctor for, labor, especially laboring at home, which is a misunderstood one. Birth in the hospital, we're going to go through induction, C-section, epidural, natural pain management techniques, just what to expect when you get to the hospital, because the hospital is a weird place. Like what happens at birth, and then we're going to go through postpartum at the hospital and then postpartum at home, and people find it so much. How much sessions are there? There are 13 lessons. It takes about 3 hours if you watch the whole thing beginning to end. If you buy the bundle, though, I have bonus videos on breastfeeding, baby care, baby sleep. I really tried to make it like a one-stop shop that you could just take and everything would be there. And it's meant to do with your partner. A lot of partners don't do it with you. But again, if you take the bundle, I actually have like a keynotes, like a Cliff Notes video, key point videos that you can just like quickly go through with them. Those take about half an hour. And it's just kind of like the high points if your partner doesn't want to watch the whole thing with you. But I really created it to make it so easy to get prepared for birth because I think it is wildly important, really misunderstood. People don't understand that you need to get prepared for talking with your provider, understanding like how to make choices in labor. Nobody seems to talk about that. They're all talking about like pain management when really the problem is making those choices in labor for you and for your family. So yes, you can find it through the link in my profile. When will I give birth? Guys, we're better than that. All right, everybody have a great day. Thank you so much for joining me, Shayla. I would love to see you in there. If you guys ever have questions, feel free to ask on one of my videos and I can let you know the answer. Have a good one, you guys. Bye.